Some of you may become somewhat uncomfortable as parts of this film unfold, but I think if you listen carefully...
Nature was intended with a few appropriate
A healthy, happy sex life is the most wonderful and exciting. We've all experienced curiosity about ourselves and the opposite sex. Who hasn't?
Hello, my lovelies. I'm Megan.
I'm Marcella.
And I'm Colin.
And welcome
to
Remedial Sex Ed.
Before we start, I want to give a fellow podcast a shout out. We got a very nice shout out from Sunny and Alex of Pomegranates and Pitchforks. I am obsessed with their podcast. They tell the true stories behind a lot of horror films. I am early into it, but they talk about the true story behind Amityville, they talk about Texarkana, and beyond that, in this last episode, which they mention us, they talk about American terrorism and the super unfortunate murder of Alan Berg. If neither of you are familiar with it, you should check it out, especially since this last episode having to deal with American terrorism and the KKK and white nationalism. They touched on a lot of like socialism and things that are wrong with like the economic divide in our country, and Colin's all about that.
I am all about that. I was very excited to listen to that episode, and I'm super excited to hear the rest of the series because they're doing a whole 5-part thing on American terrorism.
Yeah, it's crazy fascinating. If you're not into true crime, maybe skip it. But
no, don't skip it.
I mean, if you can't handle being told about like murder.
Oh, okay, yeah.
Yeah.
I guess if you don't have an interest in the macabre, then it might not be for you. But
yeah.
It certainly is for me.
I
like horror movies and horrible things.
I mean, if you are into it, and beyond that, if you want to know the true story for horror films that claim based on a true story, then you should definitely check it out. Also, another podcast shout out, Colin, you've actually been on a podcast before.
Oh, yeah.
You want to talk about that?
Nope. Yeah, I do. Obviously, like, some of my best friends in the whole world have a podcast called Fanatical Fix and Where to Find Them, and I've been lucky enough to be a big old special guest a couple times. Is a hilarious Harry Potter fan fiction podcast. Just two really funny people going to town on some very weird and very funny fan fiction. So I would recommend this to anybody, even if you don't particularly like fan fiction or Harry Potter. Give it a chance, because I wasn't particularly into fan fiction either before I started listening to it. But then I don't know, I just have a blast listening to this podcast every week. It's really cool.
My personal Twitter account is exclusively just so that I can send in predictions to that podcast. I use it for nothing else.
So, those are our podcast shout-outs. Thanks, friends!
Woo!
Today we're talking about STIs, which stand for Sexually Transmitted Infection. When you were in school, you were probably taught about STDs, which stood for Sexually Transmitted Disease. Both terms encompass everything you can catch from sexual contact with another person. The term was changed from disease to infection because everything you can catch from sex is treatable to a certain degree. I must apologize if you listened to the intro episode to this pod. I did refer to them as STDs. I want to use the excuse that the term we were taught in high school was STD. However, when I moved to London, the city was already using the term STI because London is infinitely more woke than Utah. STIs are complex and each have varying levels of symptoms and stigma. Unfortunately, 1 hour to 90 minutes is not enough time to fully unpack every single STI in great detail. So the intent for this episode is to give an overview to everything that is out there. And then at some point in the future, we will do a dedicated episode to each. For example, I think the first one that we're going to touch on is HPV, but we're not going to touch on it for, I think, like 3 or 4 weeks from now. Okay. So we will get there. We will talk about them in detail. It's going to be over a very great expanse of time because we don't want to be talking about STDs every single week. That's a selfish thing on our part, but we don't want to.
No, we want to do some more fun stuff.
Yeah. STIs are a thing, and people should practice safe sex to protect themselves from them, but I feel as though schools use STIs as a way to scare teenagers from having sex.
Yes, 100%.
Absolutely.
However, I can also say that I don't know much about STIs as an adult. Hashtag, what is chlamydia? What do you two remember about our public sex ed teaching us about STIs?
A whole lot of nothing other than STIs will kill you.
Yeah, it's weird. I don't remember getting any STI talk in high school. I remember getting it in middle school a little bit, and I want to think we even had a slideshow with real pictures of like genital warts and that sort of thing.
So that's what...
I don't remember that at Churchill.
Yeah.
Yeah, this is actually the first time. So Marcella went to Churchill, we went to Wasatch, but even Colin and I, who had the same sex ed, we have different memories of this.
Yeah.
Because he remembers a slideshow, I do not.
Yeah. Well, who did you have as your teacher?
Naming names.
I don't know.
I remember.
It was the female gym teacher, because we had Coach Niederhauser, and then we had the other coach.
Okay.
And it was the other coach.
Yeah, I'm pretty sure we had the same teacher.
Yeah.
Yeah, I remember getting a DARE style scare talk from some guest speaker about STIs.
If someone gave you like a photo lineup of STIs, would you be able to recognize which is which?
Lord, no.
So I think that's kind of like the bigger concern.
Oh yeah.
Like I cannot, and I know some symptoms of STIs. I don't know.
No.
I don't know what they do.
No, even as an adult, I know next to nothing.
I got nothing. I 100% did a lot of research jumping into this, other than herpes 1 and HPV.
Yeah,
which everyone has.
Also, everybody has.
Yeah.
That's where your hosts stand, listener.
Sorry to disappoint.
We got nothing.
We got nothing.
So we all actually have a really good friend who is currently in med school at the University of Utah. And I reached out to her. I was like, I need you to teach me about sex. And she flat out told me that, she wasn't the best person to teach us about sex. She has fellow students who have taught sex ed before. They have volunteered with Planned Parenthood in various scopes of work. And her first friend who agreed to talk with us, her name is Megan Budge. She is a first-year med student, also at the University of Utah. She has taught sex ed for years, and she has given us a very good overview of what STIs are out there. And just a reminder to our listener, this is an overview of what they are. It is not going to dive into the greatest detail of what all the symptoms are.
Called this guy. She knows his mother and arranged a date for me for the school dance.
What are the various STIs out there?
I'll talk about the general categories of STIs, and the way that I like to think about it is I think of 3 categories. The first is viral, so STIs that are caused by a virus, and those include HIV, human immunodeficiency virus, herpes, simplex 1 and 2, hepatitis B, and then HPV, or human papillomavirus. Less commonly, hepatitis A and C can be passed sexually, but that's significantly less common than hepatitis B. The second category is bacterial, and that includes chlamydia, gonorrhea, and syphilis. And then finally, I call this category generally miscellaneous, but you will see it categorized otherwise in different resources. But this includes basically protozoa and parasites, and that includes trichomoniasis, pubic lice or crabs, as you'll hear it called a lot, and then scabies. It's important to note, I think, also things that are not STIs, which are yeast infections, bacterial vaginosis, pelvic inflammatory disease, and urinary tract infections.
And can those last 3, can those be triggered by sex?
You know, there is some evidence that bacterial vaginosis is more common in people who have more sexual partners, but we don't have the sort of evidence that we have for the other STIs that I listed, that it is actually caused by sexual intercourse.
Gotcha. And just as a basic question, as a female, what causes yeast infections?
Yeah, that's a great question. So a lot of times yeast infections arise because the pH, so basically how acidic or basic somebody's vagina is thrown off, and that allows for the buildup of yeast in the vagina that isn't supposed to be there. Interestingly, bacterial vaginosis is basically the same thing, not necessarily caused by pH, but it's the buildup of bad bacteria in the vagina. So it's not a yeast, it's a bacteria, but both yeast infections and bacterial vaginosis are caused by that buildup of microbes.
Can both of these be self-diagnosed? I know they sell things like Monistat from your local drugstore, or do we always need to go see a doctor in order for these to be properly taken care of?
In order to get an actual official diagnosis, you do have to see a care provider, but a lot of people with vaginas can self-diagnose a yeast infection. Bacterial vaginosis is harder to diagnose, and you do need to get antibiotics to treat bacterial vaginosis. But like you said, there are over-the-counter products that you can use for yeast infection. Oftentimes, those can be very effective for people who have a yeast infection. For some people, it isn't quite as effective, and there are prescription medications that people can get to help with a yeast infection.
Switching back to crabs, is there any other way other than sexual intercourse that crabs can be spread?
So crabs are spread by skin-to-skin contact primarily. So that can be sexual or non-sexual contact. It can also be spread much less commonly, but it can be spread through clothing, towels, and sheets.
So hypothetically, if someone were to go to a hotel and sleep in the sheets naked and the sheets had not been washed, could that be a way to catch crabs?
Potentially that could be a way that they could spread. I would say that that is not a reason to avoid all motels and hotels in the future.
Yeah.
I think that they're generally pretty good about that. But yeah, so sharing clothing, towels, and sheets with somebody who does have pubic lice could potentially be a way of spreading.
With the overall list of various STIs that you gave, are the symptoms always visible?
No, actually, the vast majority of the time they are not. And that's especially true for people who are male-bodied, for people who have a penis and testicles, as opposed to somebody who has a vagina and a vulva. So again, the vast majority of the time, there are no symptoms. If somebody is symptomatic, they may experience symptoms like itching or abnormal discharge, whether it's from the vagina or the penis or occasionally the anus, depending on the site of infection. Unusual smells often come along with unusual discharge, growth of bumps and blisters, sores and rashes, those kinds of things, abdominal pain or burning during urination or sex, and then bleeding between menstrual cycles can be some common symptoms shared between STIs.
So in terms of knowing if your partner has an STI or not, there isn't a way to visually check them. It has to be medically verified as in the form of testing.
For many STIs, yes. Some STIs can potentially be diagnosed just by visual inspection. For example, pubic lice, like we were talking about, oftentimes they are visible. You can actually see the crabs, and they do look like crabs. That's where the name comes from. Or the person may be able to actually see the eggs of the lice in their pubic hair. So that can be visible. The other type of parasite that I mentioned, scabies, can leave physical signs, as well as trichomoniasis. Some STIs can cause genital warts or sores, and those can be visible externally, but just because somebody has those STIs doesn't mean that they're always going to have genital sores and warts. So definitely the safest way to make sure that you do not have a sexually transmitted infection that you could potentially pass on to a partner is to get yourself tested.
Excellent. So we talked about crabs a little bit. What are scabies?
Great question. That's not something that people know a lot about, but scabies are actually mites. They're little mites. So they are parasites, just like pubic lice, but of a different species, I believe. But they are spread the same way as pubic lice. So that's through that skin-to-skin contact with an infected area, also potentially through clothing, towels, and sheets. Scabies can actually be a little bit more pernicious than pubic lice in terms of getting rid of them. Mm-hmm. So patients are recommended to, of course, wash all their clothing and their linens. Also, vacuuming the areas that the patient has spent a significant amount of time in can be an important way of preventing the spread. So they're a little bit more persistent, we'll say.
Which of the STIs you listed are life-threatening if they go undiagnosed or untreated?
If you've ever read the book Candide, you may know that syphilis can be life-threatening if not treated. So that is a bacterial infection, and it can impact your vital organs if it is left untreated for a significant amount of time. Hepatitis B can be life-threatening. That's a viral STI. So it's estimated that at this point in time, with the treatment that we have, approximately 1 in 5 patients with hepatitis B can experience fatal complications. That being said, if patients are diagnosed early and receive treatment early, their chances of having a good outcome go up considerably. And then human papillomavirus can be life-threatening because it can lead to cervical cancer. And if that cervical cancer is metastasizes or causes other problems, it can be life-threatening for patients. And then HIV, the human immunodeficiency virus, can lead to AIDS. AIDS is a condition. It occurs with HIV once you have sustained a certain level of damage to the immune system, because HIV does target the immune system. The human immunodeficiency virus targets specifically a certain type of adaptive immune cell. So it's something that you need to be able to have an active, healthy immune system. They're these specific cells that we call CD4 positive. And they're very important to being able to fight off infection. And you need them throughout your entire life. And so once you have sustained enough damage to those particular immune cells, your body's ability to fight off infections goes down considerably. And so that places patients at very increased risk of infection by particularly pneumonia. And there's a certain type of lymphoma that can be more common in patients with HIV who are immunocompromised. And the list really goes on. So AIDS is a condition that is caused by HIV. And even though they are very closely related, obviously, they are not synonymous with each other.
Okay. Usually HIV, it seems to get stereotyped into correlation with the gay community. Mm-hmm. And there's still a lot of stigma towards if a man finds out that another man is infected with the virus. Are there advancements in modern medicine that can limit the effects of HIV on a person or stop it from spreading to another sexual partner?
Yeah, absolutely. And it's actually, I think, really inspiring, the medical advances that we have had recently that can help with both of those aspects of being infected with HIV. So there's a treatment, it's called antiretroviral therapy, that reduces a patient's viral load and the patient's likelihood of transmitting the disease to a partner is strongly impacted by their viral load. So basically, how much of the virus is present in their system at a specific time. In addition, reducing the patient's viral load is obviously very good for the patient themselves, for their health. That being said, antiretroviral therapy doesn't mean that the patient cannot spread HIV. And I honestly think that one of the best ways to prevent the spread of infection is just to have open communication with your partners. So condoms and dental dams can be effective in preventing the spread of HIV. And there has recently become a medication available on the market called PrEP, which stands for pre-exposure prophylaxis to HIV. The brand name for that is Truvada. And basically, uninfected partners can take PrEP daily, and it significantly decreases their risk of being infected by HIV.
Okay. Shifting gears a little bit, you mentioned HPV earlier. The rate of adults, sexually active adults, who have HPV or have encountered it is great. And you kind of get into this saying that if you've had sex, it's very likely that you've come in contact with the virus. How much truth is there to that statement?
HPV is very common. I don't have the numbers right in front of me. I can't tell you what the numbers are for people who are currently infected by or who have come in contact, I should say, with the HPV virus. It is one of the most common sexually transmitted infections. That being said, we do have a lot of great advancements in detecting HPV, specifically in detecting changes to cervical cells that can be caused by cancer-causing HPV. And we also have the HPV vaccine that's currently on the market. So there are great ways to decrease your risk of contracting the virus. And I think that when we talk about HPV as something that if you've had sex, essentially you've come into contact with HPV, I think that what we should take away from that isn't fear, but rather the understanding that it's incredibly common. And you shouldn't be embarrassed about getting a pap smear. You shouldn't be embarrassed about having an abnormal result. If you do, you shouldn't be embarrassed about getting the HPV vaccine or using condoms or dental dams to protect yourself. It's just something that is very common, and we have some great ways to protect ourselves against negative outcomes.
Can we talk about ways other than penetrative sex that STIs can be spread?
Yeah, absolutely. Skin-to-skin contact is a mode of transmission for some STIs, and it doesn't necessarily have to be sexual contact, but skin-to-skin contact is a mode of transmission. Oral sex can be a mode of transmission. Sharing sex toys, especially if you don't clean them in between people using them. Sharing needles is a really common way of spreading STIs. You may hear people talk about transfusions being a way that people may get STIs, specifically so HIV and hepatitis B. That is not the case anymore. Our current blood supply is really rigorously tested, and you do have a right to ask if the blood transfusion that you are receiving has been tested for HIV or hepatitis B. So in the vast majority of U.S. hospitals, the answer will almost certainly be yes. So that is not a way. Additionally, toilet seats are not a way that we can transmit STIs.
Can STIs be transmitted through hot tubs?
STIs can potentially be spread in a hot tub if you are having sex in a hot tub. Simply sitting in a hot tub with somebody who has an STI is not going to give you an STI.
In cases, if you are a woman and you have one of these STIs and you want to pursue pregnancy, are there options for you?
Absolutely. Yeah. So bacterial STIs can be treated and can be cured with antibiotics in a pregnant mother. There are ways, if a mother is HIV positive, to treat the woman. So early testing is really critical, and early diagnosis. And then antiretroviral therapy can decrease the chances of transmission. Cesarean section can decrease the chance of transmission as well. But really the antiretroviral therapy and the early testing and diagnosis is critical there. And then, let's see, hepatitis B, same thing. Antiviral medications when the woman is pregnant can be helpful in preventing the transmission from mother to child.
Excellent. How can we protect ourselves from STIs?
That is a great question. So it has to be said that abstinence is the most effective way to protect yourself from a sexually transmitted infection. That being said, for a lot of folks, that isn't a really realistic option. So condoms, especially latex or polyurethane condoms, as opposed to the lambskin condoms, which don't protect against HIV. Dental dams can be very effective in preventing the spread, especially during oral sex. The human papillomavirus and hepatitis B virus, we do have vaccinations against those. So getting your hepatitis B and HPV vaccine can be very important in preventing the spread of those. And then getting tested regularly is a really important part of protecting yourself from STIs and also protecting your partners from STIs.
How does one get tested for STIs?
That is a great question. So for a lot of folks, simply going to your primary care provider can be a great option. There are also a lot of local clinics that you can go to for testing. Planned Parenthood is one that is known best throughout America, but you may have local clinics run by local organizations other than Planned Parenthood that offer STI testing.
If you're a sexually active teenager under the age of 18 and you don't want your parents to find out, is there a way to get tested or ask questions regarding safe sex practices without adult consent?
Absolutely. So in all 50 states and the District of Columbia, adolescents can seek testing and medical care for STIs without parental consent or knowledge. And in most states, you can get HIV counseling and testing as well if you are under the age of 18 without adult consent. Consent laws for vaccines, so HPV and hepatitis B, does vary by state. So you'll want to check your local laws, especially about the HIV testing and then those vaccine options. That being said, where teens often encounter trouble isn't necessarily in finding a place where they can get tested without having to tell their parents if that's something that they feel like isn't an option for them. What can be a little bit more problematic is when it comes to billing, especially if the teenager wants to bill to insurance if they are on their parents' insurance, or if they're using a credit or debit card for which their parents can view the monthly statements. So it's really important if a teen is seeking testing and they do not want their parents or guardian to know, that they check with the clinic about cost and billing before they receive any tests or treatments so that there aren't any unwanted disclosures. This is a problem that we also see come up for patients who are maybe potentially in abusive relationships. So having that conversation ahead of time is really important. That being said, I think that for teens who go to seek testing and counseling, they will often be encouraged to tell their parents if at all possible, because parents are a really important source of support when you are a teenager, for most of us. So that's something that is an option. A lot of times parents will come through for their teenagers. Obviously, that isn't always the case, and everybody should take steps to be safe. But that's something to consider as well.
So I have a question for you that comes from my co-host, Marcella. Mm-hmm. We are currently reading The Joy of Sex for a book club segment we're going to do on the show. And the book states you can transfer mouth herpes to genital herpes. Marcella has previously heard that the two different strands, that these are two different strands and they can't be transferred between the two. So where is the truth in that?
Yeah, so there are there's herpes simplex 1 and herpes simplex 2, and either can cause an infection either orally or on the genitals. So you can have a herpes simplex 1 infection around the mouth or on the genitals. Same goes for herpes simplex 2. So what really defines what type of herpes infection somebody has is the actual virus that causes them, not necessarily the physical location of the infection. That being said, generally speaking, herpes simplex 1 is more commonly associated with an oral infection, and herpes simplex 2 is more commonly associated with a genital infection.
But just because of the location doesn't necessarily mean that they can't be transferred to another location on the body.
Correct. Yeah.
If you find out you have an STI, what happens next?
Yeah, so it's going to depend on the specific STI that you have. So that's every teacher's favorite answer is it depends. But your healthcare provider should give you instructions on appropriate next steps. So some clinics will treat you and your partner for free for certain STIs, especially the bacterial ones that can be treated with antibiotics. And you may have to notify past partners, and that's going to depend on the specific STI that you have.
Do you have any advice for contacting past partners?
Yeah, so it's obviously going to vary from person to person and the relationship that somebody has with their past partners. But healthcare providers are required to report cases of chlamydia, gonorrhea, syphilis, and HIV/AIDS. And that is going to be that information that is not going to be associated directly with your name, but they do have to report those infections. You are required to report to your previous partners gonorrhea, syphilis, HIV/AIDS, and sometimes chlamydia, and that's according to local legislation. And a public health official or social worker may be able to help you with this. They may ask for names of anyone that you may have caught the infection from or given it to, and they can actually help with contacting these people without giving your name specifically and encourage your past partners to get testing and treatment. And you also obviously have the option of contacting partners yourself. There are some notification resources out there. One that I have heard about, and I know that there are others, but the one that I'm most familiar with is called inspot.org. So that's inspot.org. And it's a partner notification service. And so you can use that actually to reach out to past partners, and it can be anonymous so that you can let them know that they should get testing and treatment. And that's a really important way of protecting your partners and protecting the community as a whole.
You mentioned earlier that lambskin condoms don't protect against HIV.
Yeah.
Are there any other condoms that don't protect against various STIs?
As far as I am aware, the latex condoms and the polyurethane condoms that are available on the market protect against STIs that can be spread through penetrative sex. Like we talked about earlier, there are some STIs that are spread through skin-to-skin contact, or by coming in contact with a genital wart or open sore. Condoms are not going to be particularly effective in preventing the spread of those STIs. But as far as, so what's going on with the lambskin condoms is that there are actual pores in the lambskin, and the pores are too small for most STIs to get through, especially the bacterial STIs. They're not going to get through those pores, but HIV is particularly tiny, and it can get through those pores. And the same is not true for latex and polyurethane condoms.
How frequently should a sexually active adult be tested for STIs?
Great question. And again, the answer really is, it depends. So if you think that you or your partner may have been exposed to an STI, then you should get tested. It's recommended that you get tested before you start having sex with somebody new. And then, like we talked about earlier, pregnant women are typically screened for specific STIs because of the increased risk of transmission to the fetus or possible complications during pregnancy. I would say that the biggest myth when it comes to STIs is this idea that getting tested for STIs is kind of an abnormal thing, or having an STI is abnormal. For the vast majority of the people on the planet, sexual contact will occur at some point or another in their lives. And when you think about that, think about if you worked at a hospital, you were always around people with colds, nobody would be surprised if you got a cold. And that yet there is so much taboo about having a sexually transmitted infection, despite the fact that sex happens. And so I would just strongly encourage people to reconsider that attitude. And if we can remove the stigma from sexually transmitted infections and getting tested for them, it will dramatically improve the health of our population and can make life just so much better for people who have an STI.
Excellent. Thank you, Megan. That's a great note to depart on. However, I have one more question for you.
Great.
I feel as though when STIs were talked about in public school education, it was intended as a way to scare teenagers from becoming sexually active.
Mm-hmm. Yeah, I think that is often how it is presented to teenagers. There's that classic scene from Mean Girls where the health teacher tells the students that if you have sex, you will get chlamydia and you will die, which I think pretty well encapsulates what you are talking about. And it is presented that way, and it's really unfortunate that it's presented that way. There are some STIs out there that are concerning, you know. I think most of us are probably aware of the immense amounts of tragedy in this nation when HIV first started to appear in the population. And we do have some very effective treatments that are currently available for HIV. But it does remain an STI that can have considerable complications if it's not diagnosed and treated correctly. So there are definite, I'm not trying to say that STIs can't have significant complications and consequences for patients, especially if they aren't treated. But I think that the way to approach that situation isn't to treat it with shame or make people feel badly about having them. I think that the way to treat that is to improve communication between care providers and their patients, improve communication between partners, and then making it easier for people to seek testing and treatment. And that is really how we should be talking about STIs, and not as fear-mongering. One thing that we do find occasionally is that when we talk about STIs as something that if you have sex, you will get, and it will have bad consequences for you, is that sometimes people, when they start having sex for the first time, don't use protection because they don't think that it will do much for them, because STIs have been sort of sold as this thing that is going to happen no matter what if they have sex in the wrong context, depending on whoever taught them that information. And that obviously increases the risk of spreading STIs. So it doesn't have great effects on our health when we talk about it that way. So yeah, changing the shame-based narrative I think that we have around STIs is really critically important.
Thank you, and hopefully we'll be able to interview again sometime soon.
Thank you so much for having me.
What makes them think that when I hit my 16th birthday, all of a sudden I'm old enough than I wasn't the day before?
So what are our reactions to the interview with other Megan?
Other Megan.
Super helpful. I mean, I really appreciated her, breaking them down by what type they were, viral, bacterial. Honestly, the protozoa and parasite one, I didn't even realize that was its own separate thing. That's how little I knew. But obviously, that's its own little category. I found her super helpful.
Yes, I thought it was a great interview that I listened to all the way through.
You're the worst.
Okay. Megan, it must be real easy being married to somebody who can't lie.
My reaction, so it was really easy to interview her. I went in with set questions, and those questions got expanded upon. Talking to her, there are definitely things I want to dive into further. HIV and AIDS was really the one I remember being taught about in schools.
Mm-hmm.
And I even remember being taught about it in elementary school. They had this public safety announcement video with puppets. And kind of the story behind this was one puppet had HIV and the other one didn't. And it was to teach that you can't shame the puppet. Don't shame someone for having HIV. You can't get HIV just from being around someone who has it. There has to be sexual contact or blood transfusion. You can't get HIV just from being associated with someone.
And that's what the puppets taught you.
Yeah, the puppets taught me that.
Okay.
Yeah. I was 8.
Did you have any context for that when you were 8?
No, but it was just a kind of... Remember, we grew up in the 90s. This was just fresh off of...
That's true, the big AIDS panic.
Yeah, and it was to try and kind of correct a lot of misinformation that was out there.
Mm-hmm.
Right before we were born, it was terrifying.
Yeah.
And people were being fired for having it and dying for reasons that weren't fully understood. They were just trying to reassure people from a young age that it's all going to be okay.
That's really interesting. I don't really remember anything like that. I did most of elementary school in California, and then I moved to Salt Lake City. And I feel like we definitely did a "this is what your body is going to do" class, but I don't know that we touched on AIDS even at that level.
Yeah, I definitely didn't get any AIDS talk, or I guess I'm trying to remember back to DARE class, because that's probably the place where it would have happened. We we might have talked about it in the context of
Yeah.
like sharing needles. But no, I didn't get any fun puppet shows.
When I think about junior high, again, I don't remember being taught what chlamydia, gonorrhea, crabs, any of those were, but I
No.
do. There was a lot of emphasis on AIDS. Like,
Huh.
that was kind of the big one that they taught us about. And I also. So if HPV is going to be the first one we're going to dive into more detail about, HIV and AIDS is definitely going to be the second. Because they told me a lot of information that I don't think is true.
Mm-hmm.
And I think that's why in the interview with Megan Budge, that was the one that I kind of asked more questions about. Because with modern technology, there are options. Especially if you're still in the HIV stage. You can take medication that will lower its presence in your body. And also, if you are having sex with someone who is tested HIV positive, you can take medication that will protect yourself from catching it. So, if you were educated in public school sometime between the 80s to the early 2000s, seek out updated information regarding HIV and AIDS, because it has made a lot of headway and there's a lot of scary misinformation out there about it. Now, I want to say that to reassure the public. However, I do not want to undersell the fact that AIDS is a serious disease and it still can lead to death. Like, what's the proper way to phrase that?
No, you want to understand. You don't want to minimize the severity of contracting AIDS.
No, I don't.
New York City actually has a really great campaign. So I, being a useless human, am not constantly doing research on STDs and HIV and that kind of things. But I knew about PrEP, and I knew about the drugs that people can take in order to lower the severity of their HIV symptoms, because the New York City subway system constantly has ads talking about PrEP and talking about other STIs and letting people know, like, this is what PrEP is. Always be in communication with your partner. If your partner has it, it doesn't mean that you're going to contract it. And just like really promoting communication. So I really have to give it to New York, because that's something that I just absorbed sitting on the subway every day.
Yeah, the LA Metro has a lot of ads for PrEP too. AIDS is very treatable now, but it's not curable.
Yeah.
But it's not like in
Yes.
the 80s it was just almost like a death sentence.
It's
Yes.
so sad.
Absolutely.
Like, this is going to be a heavy episode, guys. There's
Yeah.
no fun way to talk about HIV.
No, not even with puppets.
Not even with puppets, but you know what? It makes an 8-year-old feel a lot better.
Yeah, it does, and I'm glad that they did that for you, because yeah, if I'm sort of picturing that time, there was a ton of stigma about HIV and AIDS, and that it was treated as the plague, or to be more on the nose, the gay plague, and there was just a whole lot of negative attitudes that went into that. So it's cool that your elementary school did something to combat that.
Yeah, and there's still a lot of negative attitudes that go into it, because I have this memory of watching, I think it was Comedy Central with another person, and a commercial came on for the at-home HIV test kit, and they said something along the lines of, if you have HIV, then it's your own fault for getting it. And that is horrible and not true. But there are a lot of people out there who believe that. Mm-hmm. And if you believe that, stop. Like, it is no one's fault that they caught anything. Saying that it's your own fault that you have HIV is like equivalent to saying it's your own fault that you have lung cancer. It's your own fault that you're sick. Like, any sickness is not the fault of the person who has it.
Right.
Period.
It's also just a useless statement. Like, even if someone did get it from having unprotected sex or like using heroin and using dirty needles, does that mean they deserve a horrible illness with all sorts of stigma attached to it? Does that mean they deserve to die? I mean, really think about what you're saying.
Marcella, do you have anything to say? I mean, HIV and AIDS kind of does get tied into the LGBTQ community a lot, just because, especially in the 80s, a lot of gay men who are having unprotected sex, because if you can't get pregnant, why bother?
Very faulty logic.
Very faulty logic, because you can still catch STIs, and I think the HIV/AIDS scare really showed what a huge problem it was.
Yes, if there was any if any good came out of that, then it was awareness about STIs in general, that everybody needs to wrap it up, even if you can't get pregnant.
I'm glad that people are aware that it's not just affecting that community. It's something that any of us can catch from any of our partners. However, I just want to reiterate, AIDS and HIV are different things. Mm-hmm. HIV can lead to AIDS, but again, with the medical treatment and all of the advancements we have, we can prevent people from contracting it.
Well, yeah, I think that's a great thing to point out. I mean, it just goes to show you that there's really no reason you shouldn't be getting tested regularly. Sure, there's a lot of shame associated with it, and I know about shame. That's my wheelhouse. I live in shame, but we can. It is relatively easy to live with HIV now. Like, we can prevent it from developing into AIDS. So, all it takes is a little swab.
And on that note, are we all actually, on a positive note, are we all so impressed and kind of blown away at the medical advancements that have happened for HIV?
Absolutely. I mean, it is crazy what they're doing in order for treatment for HIV, but also, as a super small, tiny tangent, because I don't have as much research on this as I should, there was a great article in the Wall Street Journal a couple years ago about how HIV is being used to treat cancer now. They're like doing crazy things in order to use the way that HIV attacks cells within the body to attack cancer cells. And I think that's fascinating, and I'd love to do more research on that. But I've got not enough information to go into it into detail. I just know it's a thing that researchers were attempting.
I'm absolutely blown away, and I'm really happy, because for any stories about major illnesses and ways that we are fighting to combat them makes me happy. So when I see the advancements that have been made to make HIV livable, that's a yay. When I hear about that being used to attack cancer cells, that's a yay.
That's a very yay.
That's a very big yay. So, way to go, doctors.
Yes. And thanks, doctors. Mm-hmm. I was quiet for a sec because I wasn't sure how they actually test for HIV. Because I said it was just a swab, and it may be a swab. They can test it.
It's a blood draw, isn't it?
They can do a finger prick or oral fluid. So I'm guessing they just do a swab of the inside of your mouth.
That is actually true, because that's how the at-home HIV kits work. Mm-hmm. You are correct, sir.
So it's a finger prick or they take a sample from the inside of your mouth.
Yeah. So I am very fortunate that the only STIs I have come across are crabs and HPV.
I had a scare one time, and what had happened is I was practicing ethical non-monogamy, and I had two partners, and one of my partners reached out to me because one of his previous partners reached out to him to let him know that she had contracted chlamydia, and that she may have had it while they had been sleeping together. He was so responsible, and I just have to applaud the way that he handled the situation. He went to the doctor. He got tested, but usually when you get tested, before you even find out the results, they give you the medication just in case, because you can just take medication and then it'll clear up on its own. He got the medication. He gave it. He got some for me to take just because I had a scare, so I should just take the medication. I should also go to the doctor and get tested, absolutely. But yeah, he immediately contacted me as soon as he heard about it. He gave me medication for it. Like, it was just such an adult way of handling it. I feel like there's a lot of stigma, and people get really scared of confronting people and telling them this big thing. And I think he was a little surprised by how I reacted, because I was just like, hey, thank you. Like, I really appreciate you being open and honest about it and not, I don't know, sweeping it under the rug and not telling me. And then I obviously contacted my other partner, and while it was very hard for him to hear, he and I went ahead and I got tested. I got him the medication, and then after all was said and done, neither the partner who contacted me nor myself had chlamydia. It had just been a scare. We didn't contract it because of proper use of condoms. Woo, condoms. But I was just really impressed by his level of communication and the way that he handled the situation. And I just want to applaud that and highlight that, because I think that's how we should all be treating these scenarios.
100% agree.
Yeah. Seems like a situation where everybody did everything right. You used condoms, and then you communicated properly, and then it turned out to be all okay. So yeah, A+ to both of you.
Thanks.
I'm embarrassed because we got crabs once, and I don't know where it came from.
That's why I asked like a million questions about crabs.
I was gonna ask you why you asked that question. It's on the notes. I was like,
It's
Megan,
like, so hypothetically.
why are you asking that?
Okay, now I guess now that I'm talking about it, we can leave it in, because
So what happened was we got this at a time. There were 3 major factors, and it's impossible to pinpoint what had actually happened. So we were moving apartments to my friend's apartment, and I had slept in her bed, and we were moving stuff for her because she unfortunately had to leave the country in a really quick time frame. She got fired from her job.
Oh, yes, I remember.
Yeah, so I was responsible for kind of like cleaning up her apartment and getting it ready to go, but I don't want to pinpoint her because we were also house sitting for one of our other friends. And that apartment complex was having all sorts of other problems as well. But I don't want to point that friend because I was also traveling for work at the time. And I don't want to give the public a big, like, hotel scare because I travel for work constantly. Like, I am in a hotel room at least, on average, once to twice a month. And for most of the time, I'm fine. But we got crabs somehow.
Somehow.
Yeah.
And both of us say that we didn't cheat.
And both of us believe.
And I believe you,
Yeah.
and you believe me. Itchy, embarrassing time.
Yeah. And it was an interesting moment as a couple,
Yeah,
like taking care of that
definitely.
together, because we had the kit, and it was like, I'll do you if you do me.
Yeah,
That's bonding.
that was some bonding.
And we did get rid of all the body hair.
Yes.
And Colin
Yeah, I was
is-
itchy for a long time after that.
Can I ask what the motivator to not going to a doctor and seeing what it was?
Oh, I guess just shame.
I mean, crabs and lice in general.
They're
is
pretty treatable over the counter.
Yeah, it's self-diagnosable.
Okay.
And I didn't have insurance. No, I did have insurance at the time.
You did.
Yeah.
It was just, I think it was more convenience more than anything. A lot of the times I'll put off going to the doctor just because, outside of this podcast, I work on average 60 hours a week.
Yeah.
So getting to the doctor is a little difficult sometimes.
Sure.
Mm-hmm. Well, because I have Kaiser, and I like Kaiser, but you have to make your appointments way in advance. So, like, on average, it take me 2 weeks to get in to see a doctor, and I can just go to CVS and get the lice shampoo and take care of it in 10 days. So, by the time I would be able to get in to see a doctor.
When I went Heart of Darkness on the apartment,
Yeah.
like I got like the spray that you use for lice removal on like couches, and I like attacked the mattress, I attacked the carpet, like we went to town on the apartment.
Yeah. And we were used to it because we had gotten fleas just a couple months prior.
Oh, wow.
Yeah.
And the fleas did specifically come from the apartment of the friend that we were house sitting for. That one we know the origin story.
Right.
Yes.
Yeah.
So the cat got fleas.
Yeah.
And then the cat gave us fleas.
Yeah.
And then we brought fleas into the apartment. An itchy summer.
Yeah, it was.
I have a question for you two, since you've been in a relationship for so long, which I really haven't. Have you gotten tested since? Do you do STD tests with your annual doctor visit?
I do. So I've been STD tested a couple of times. So I did it regularly when I was single because I had that lifestyle choices, And then I did it when Colin and I decided to swap to birth control only, to ditch the condoms, just to make sure everything was on the up and up.
Just got to make sure that Colin. I'm kidding, Colin. I love you.
A dirty boy.
Oh,
And
no.
then I got tested again when I changed my primary care physician in California. And then I believe they insist that you get tested when you get an IUD, which I've only had for 2 years or so. But the last time I changed my primary care physician was last year. And this is actually important as to why it's important to still get tested, even if you're in a monogamous relationship, because that test revealed that I actually am positive for HPV. So HPV can live in the body for up to 20 years without being detected. And getting that positive test result back was interesting because I didn't know that at the time. And it was this fascinating experience where she first told it to me, and my initial reaction was one of fury because I know I haven't slept with anyone.
I was wondering how that would feel.
So it must be.
We lightly covered it with the crabs experience, but...
Yeah. No, I was furious. And then she went into how it can go undetected for so many years. And I'm like, oh, okay. And then I come home, and obviously I have to tell Colin.
Yeah.
And I watched him go through the exact same reaction. He's like, oh, do you? Oh, do you?
I also have, and so that's why it's like one of the ones that I have done the most research on. And I find it fascinating because like there's over 200 different types of HPV, and then like 40 different kinds that can infect your genitals. And then I think it's 2 different types of HPV can cause genital warts, and a dozen different strains can cause cancer. And so there is just so many different types of human papillomavirus. And according to Planned Parenthood, and that's something I should cite, all of the information that I'm bringing up is definitely from the Planned Parenthood website. But it's the most sexually transmitted infection. And according to their website, if you have sex, you will have HPV at one point in your lifetime.
Yeah, that's the information I pulled up too, is that basically if you're a sexually active adult, then you have HPV pretty much.
Yeah.
And I just want to iterate what we just talked about. So we're 2 weeks from now. So next week we're talking about birth control options. The week after that, we're going to have a discussion about what is sex, because it is probably very common. Hold on.
Yeah, sex is pretty common.
It is. Okay, so 2 weeks from now, we're going to have an episode where we're going to have a discussion about what is sex, because many people strictly define sex as vaginal penetration from a penis. But
Those heteronormative folk.
But
Scum.
no, like oral sex is sex. Skin to skin contact, we're gonna get into a bit of a debate about, and I would classify anything regarding contact with the genitals constitutes as sex, and part of my reasoning behind defining that is how you get HPV. It isn't just transmitted through vaginal or through penetration or through oral sex. It is transmitted through any skin-to-skin contact.
Mm-hmm.
So if you're part of that subset, what's the right way to say this? I know for a lot of devout Christians, they define sex as penetrative because it helps them with the abstinence until marriage finish line, if you will.
Mm-hmm.
But I'm really sorry. Even if you waited until marriage, if you still had skin-to-skin contact with another partner, it is very possible you have HPV.
Mm-hmm. And no shame there. I mean, everybody's got it.
Yeah, no shame. Everyone has it.
You know, but you should get tested for it because it can lead to cancer. And the effects of HPV, from what research I've done, tend to be worse for women and people with vaginas than for people with penises. I don't know where I'm going with this. It's not as bad for me.
It isn't. Although I did find out that while most of the cancers that are caused by HPV are cervical cancer, it can also cause cancer in the penis, the anus, mouth, throat, vulva, and vagina.
It is very likely, even if you're sitting there being like, I've never had HPV, you don't know that. It's very likely that you had it and it went through your system undetected, because that's also very common.
Yeah, most types of HPV will clear themselves up. So I know that a lot of the time, like when I got a positive HPV result, the doctor was like, yeah, no, basically, you don't do anything and then come back in a year, and if it's still there, then we'll look into some stuff. But really, it was just like, cool, you're good, bye.
If you're a teenager and you've tested positive, there are going to be some cases where you really can't talk to your parents about sex. And if your parents are the type of people who, if you came out of the closet, would put you into conversion therapy, oh my God, I am so sorry. But in most cases, your parents just kind of have this shame about it. You can tell them if you're in trouble. Like, talk to your parents.
Yeah, for the most part, talk to your parents.
Yeah.
On the flip side, there is a lot you can do on your own without parental permission. No matter your gender, you can always go to Planned Parenthood to do an STI test, and they can give you advice or treatment. So you have options.
I don't know, what is your guys' take on that? Because I always knew that if I was in any form of trouble or had any form of questions, I could go to my parents. Both of you came from more religious families. If you were actually in a situation in high school where you were in sexual trouble, would you have felt comfortable talking to mom and dad?
You know, I think that sometimes it doesn't even matter how loving and supportive your parents are, because of the shame that we have put around sex and sexuality as I'm going to say specifically as a nation. I wouldn't have necessarily gone to my parents for everything. I know that for a fact. And my parents are very, very supportive and loving. And while I didn't really come out to them until
this podcast.
December, no, until right now. Christmas, actually, just a couple months ago was the first time that I spoke openly to my parents about being bisexual. They already knew. My Facebook account was not super secretive. And also, so what I'm trying to say, my parents are really loving. My parents are really supportive. Maybe they don't understand the choices that I make. But I didn't feel comfortable necessarily telling them, even knowing how loving they are. So that might not even be a consideration that teenagers have. And I would really caution against that because I regret it. I regret not being more open with my parents. I regret never telling my grandmother that I was bisexual. Like, I think that the more we talk about all of these different things, the stigma will go away, and hopefully that allows younger individuals to be more open in the future.
Yeah, that's really well put. I think my story is pretty similar. My parents are very supportive, and I mean, I suppose I did grow up in a religious household. I mean, not really. I didn't become super religious until I was a teenager, and then it was me. Like, I was by far the most devout religious person in my house.
Your brother?
Well, yeah, me and my brother. We're definitely. My dad was never a religious person, and my mom was sort of had more mainstream beliefs, but my brother and me sort of caught the evangelical bug and were really, really devout when we were teenagers. So it's kind of a weird dynamic there. And I know, looking back, that if I had any sexual problems, I could have easily talked to my parents. I don't think either of them expected me to wait until marriage to have sex. That wasn't really in either of their belief systems. So I know, looking back, that I could have talked to them about anything, but of course I probably wouldn't have, just because of the shame I would have felt.
Yeah. I think it's something that we put on ourselves more than something that our parents put on us.
Mm-hmm.
So would you both agree, if you are a teenager and you find yourself in an STI scare or in a place where you maybe not be the safest situation, you should talk to your parents?
I mean, I don't want to put a blanket statement because relationships with parents can be so complex and they can be abusive, and there's a lot of other things, underlying issues that could cause people to not want to talk to their parents. But in most cases, if you have a good relationship with your parents, I absolutely recommend talking to them, because ideally a parent's number one priority is taking care of you and making sure that you're safe and that you're healthy.
Yeah.
Excellent. We went a little off topic. I mean, it is related.
It's absolutely related, especially because we're talking about remedial sex ed, and a lot of this is because it's not being talked about in schools. So in a world where we do have a younger viewership, I would love to encourage open communication.
Yeah, me too. Don't do what I did.
Yeah. Everyone will tell you this when you're a kid, and they'll say like, oh no, you'll regret it later, or oh, you can do this, and blah, 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 blah. And as a teenager, I was like, that's total BS. I know better. Look, I'm 28 years old, basically, and all of a sudden I'm like, God, I wish teenage Marcella would have listened to everything adults were saying.
Yeah,
mostly.
I mean,
mostly.
Yeah, and adults. Not every adult knows what's best for you, and not every adult has your best interest in mind, but most of the time your parents do. But again, that comes to dear teenager, that comes down to your relationship with your parents, and so sometimes you have to check in with yourself and just say, okay, are my parents really wrong about this, or am I being a teenager?
Yeah, check yourself, teenagers.
And you can, I mean, and because I remember having having those moments. I even have them now sometimes. Like, are my parents really wrong about this, or am I just being a butt about it? And, you know, when it's a serious topic like your health, I think it would behoove you to check in with yourself like that.
Absolutely.
Speaking of checking in on yourself with health, normally I would advise our listeners to look up and Google things we have talked about on this podcast. Normally. However, if you're like me, you look something up on WebMD and immediately you think you have it. And I want to encourage you to be informed and seek knowledge, but keep your head about you. Remember that having a vagina will lead to discharge in normal situations. It doesn't mean you have gonorrhea. If you have pubic hair removal, if you do pubic hair removal, you can get an ingrown hair. That's not a genital wart. And anytime you think you have an STI, go to see a doctor.
Yeah, it's a good test.
Don't rely on the internet. Yes.
I remember when I was in middle school, I thought I had warts on my penis because as you're growing, you see certain changes in things, and so I was convinced that I had little warts on the head of my penis, but it turned out to be just totally normous penis texture. Like, that's just how it is.
When I was in junior high, like, periods aren't always regulated. Like, every talk about menstruation cycles is like, once a month,
yes,
you
when
will
the
get this
full
little
moon.
friend. Yeah.
Yeah. BS.
No, they're not regulated every single month, and puberty is a hard time for your body, all right? It is all out of whack, and there was this time in, like, 7th grade where I went, or it might have been 8th, I went, like, 3 months without having one, and I was convinced that I had the virginal conception. Like,
You're carrying the Antichrist.
yeah.
Oh, man.
So, no, I wasn't, obviously. You know, your body is weird. If you're a virgin, you're not pregnant.
Yeah, also,
Yes.
if you're a virgin, you don't have genital warts.
No. So, do you have any, like,
Yeah, do you have any?
obvious that was never a real life situation?
Me, personally,
Yeah.
I would like to say something that I'm really bad at is being aware of my body. So many women can be like, oh, every time it gets close to my period, this, and this happens. I feel these, and these sensations. And all of those sensations obviously vary from woman to woman, but I, for the longest time, and even still now, really didn't get any of that sensation or feeling or warning, or I'm just not very acutely aware of my body. And I remember that when I was a teenager, when I was a teenager, I started seeing vaginal discharge. And as a late teenager, I was having oral sex. So I got really scared that would mean that I had an STD. And no, vaginal discharge is really typical for women to have just in their day-to-day lives. And the thing that I wanted to highlight and to say be aware of your bodies is you should be aware of what normal, like, discharge or any of those kinds of things look like for you, because that's a really good signifier if anything changes in your body. Like, if things start to look different, that's when you should be concerned. But yeah, like, that's something that I don't think that I really appreciated as a teenager. Like, I know that they mentioned it in health, but I think that I saw discharge and was immediately like, that's an STD. Do.
I've always been concerned with the amount of vaginal discharge I have. It's totally normal. But, like, since
normal.
nobody talked about it, it's... No one.
Oh, it's definitely something that guys don't know about. Is discharge.
Yeah,
Yeah.
and it's a thing.
This is going to sound awful, but the first time that I felt vaginal discharge was normalized in any kind of way was when Amy Schumer used it in a stand-up episode. And she literally was just like, I'm sorry, but any girl that like picks up underwear and is like, oh, I wonder if I've worn this or not. No, that's not true. You know. And I just have to appreciate Amy Schumer for that one joke because it made me feel more like I accepted my body more.
You know what? If you want sexual situations to be normalized, she's actually an excellent comedian because I feel she also was the first person to normalize having a condom fall off and get stuck inside you with train wreck.
Mm-hmm. I also,
Like, everything she talks about, normal.
Yeah,
Can we also
exactly.
talk-
I mean, I'm not going to give her a blanket statement. I think she's controversial for specific reasons. But I will say that I really appreciated her normalizing these kinds of things.
Yeah. In terms of vaginal discharge, if it does change, that doesn't necessarily mean that you have an STI. You might have a yeast infection. And the first few times that you get one of these, definitely see a doctor. But as Megan Budge said in the interview, it gets to a point where you can self-diagnose yeast infections, and you can get over-the-counter medication for it because, again, as a woman, that just happens sometimes. Speaking of internet searches getting out of hand, let's talk about Blue Waffle for a second.
I have no idea what this is. I don't know what's happening. Explain to me what this myth is.
Okay, so Blue Waffle is 100% not a real disease, but if you Google image search it, you will get a plethora of terrifying images. And I could see someone who isn't educated looking at these things and getting totally freaked out because it looks disgusting. But there's two ways to totally debunk Blue Waffle. First off, none of the images look the same. Not a single one. Also, they are obviously, a lot of them, some of them are photoshopped better than others, and I think, but I saw one image of like a blue vagina that had fallen off and was in someone's hands. That's not real.
Blue. Like the labia?
No, like, I think they just took a blue Photoshop filter and, like, cut out the triangle. Like, had it in someone's hands.
That is ridiculous.
Okay.
Yeah.
Are you looking at them now?
I'm attempting to Google it. This is probably a horrifying experience.
Yeah,
It's gross.
This is a meme that I heard about back in the day when shock sites were really like there was Two Girls One Cup, there was Pain Olympics, there was Goatsy and all that stuff, and people would like try to trick you into looking at them, and Blue Waffle was one of them. Oh, Lemon Party, that one was actually funny. And yeah, Blue Waffle was another one that someone would try to trick you into searching, and you'd see a bunch of gross images. So I knew enough to not search any of these things. I have seen Goatsy, and now I'm just more impressed than anything.
What is Goatsy?
He's a guy who is really into like dilating up his butthole real big, like fitting traffic cones up there.
Okay, Goatsy. There is an entire Pinterest dedicated to Blue Waffle, which
That is gross.
really,
Why?
really sad. I'm not about that.
Horrifying. Yeah.
So
I did
I've
the
never actually
Googling.
seen it. What does it look like?
Sorry?
What does it? What do the? Don't show me. What do the pictures look like?
I will show you.
Don't show me.
I'm showing you.
No, don't do it to him. I regret it. No, honestly, it's showing a bunch of like large-sized warts, but none of the pictures actually relate to each other. There doesn't seem to be any common theme. They're just showing like horrific images of the vagina, or like there doesn't seem to be a common trend. It's just like people found scary pictures on the internet and were like, this is this thing.
And it's really sad because there are also like these websites called like bluewaffle.com that try to really sell that it's a thing, and then there's other like third party like marysmedicaladvice.com, which also insists that it's a thing.
Really?
So, yeah. So I want to
Like some
reiterate.
WordPress blog?
Yeah, so I want to reiterate a mantra that I said on last week's episode. If you can't find any information regarding your sexual medical questions from the CDC, also known as the Centers for Disease Control and Prevention, the AMA, also known as the American Medical Association, or the NHS, also known as the National Health Service, it's not a thing.
I am actually, so yeah, Blue Waffle's just a meme. It's not real. I'm looking for other, like, STD urban legends online.
Oh, I have one.
Yeah?
Mm-hmm.
They can't spread if no one comes.
Real? I have not heard that one, but I see how people would believe it.
That's a total
That is
bullshit.
Not true.
Yeah, of course.
Not true. That was, the only reason I remember hearing that as a teenager, but the only reason I thought about it now is when I was looking at Planned Parenthood's website on all of the different STDs, and they were like, they can spread if no one comes. Like, that is not a thing. So, yeah, no, that's something I definitely heard as a teenager, and I just want to shout it out on here as complete and utter bullshit.
You know what? You're right, Marcella. I also heard that as a teenager.
Yeah.
I did not realize that you could get STIs from oral sex until a friend of mine did a human sexuality course in college.
Oh, really?
That is a true story, because I believed it had to be P and V or P and B, and yeah. So I've never gotten an STI through oral sex, and I'm really lucky because I didn't realize that until after the whole virginity loss happened.
I think
Yeah.
you're probably in good company there, though, unfortunately.
Yeah, no, I think it's totally true, and I think that's why people don't use condoms when giving oral sex or dental dams and stuff like that, is because people just don't. They're like, the risk is a lot less. But, like, no, you should be protecting yourself in any kind of sexual format.
Mm-hmm.
Yeah. I'm also looking up some STD myths and legends. Or, sorry, that's what the website is calling them, STDs. So does anybody remember hearing about people, like, going around with HIV needles, HIV-infected needles, and just
infecting
poking
people?
random people?
Mm-hmm.
Yeah, that was a myth that I heard that was totally untrue.
I have a friend who is legitimately concerned of becoming addicted to an in vitro, whoa. I have a friend who is worried about becoming addicted to a drug just because somebody's going to stab him with a dirty needle. And I'm like, who is going around stabbing people with dirty needles?
Yeah, I think that's been an urban legend for a long time, but there's absolutely no truth to it.
Mm-hmm.
Never happened. What else? What else did we hear? Remember all those... okay, so when we were in junior high, there were, like, 2 really big moral panics. The first one was the sex bracelets, scare quotes.
Yeah.
Remember jelly bracelets, like, getting banned because it was each one was supposed to correlate to a sex act, and how ridiculous the idea of that was. It's kind of creepy. Like,
Black meant sex.
yeah, black meant sex, or, like, green was a hug. There's all different levels of contact. But it's kind of like this creepy way that local news will just, like, invent ways to speculate about the sex lives of teenagers.
Yeah.
Like, it's really gross when you think about it. And these moral panics, they pop up all the time. There was another one. Remember talk about rainbow parties where supposedly all the girls were wearing a different color of lipstick and lining up and giving boys would, like, go through and get a blowjob from each one.
What? I never heard of this.
It was a moral panic. It was, like, on the local news.
I remember hearing about this, but I feel like I remember hearing about it on, like, some sort of TV show.
Yeah.
Not necessarily... I don't know.
It was
yeah. not a thing I ever did
yeah.
in high school or was
No,
aware of
which
anyone
high school are these
doing
people
in high
going
school.
To? So it's like a daytime talk show sort of, moral scare thing.
How are your kids getting sexually active?
Yeah.
Find out tonight at 9.
Yeah, like,
Oh,
am I the
God.
only one who thinks it's kind of creepy and weird? I mean, I guess all parents worry that their child is having unsafe sex, but then there's something like prurient and gross about the way we speculate about teenagers' sex life.
If you take one thing away from this episode, it's that safe sex is fun sex. Wear a condom, use dental dams, no glove, no love.
You can also use gloves.
You can.
Gotta lube that up, though.
Yeah.
Lube them up. Safe sex is fun sex. However, we should remove the shame from STIs. No one should be striving to have one. However, other Megan made an excellent point. Everyone has sex. It is only natural that STIs will happen. So if you think you have one, get tested. If you have one, that's okay. Seek treatment and keep being fabulous. To our listeners out there, if you are afraid of STIs, I think everyone is, but you should do with that fear is to practice safe sex. Do not shy away from STI testing, and chill out a little bit.
Yeah, don't panic.
Yeah, there are very sexually active adults out there who are doing just fine.
Mm-hmm.
Hiya.
Any other closing statements from you two?
Get tested.
Yeah, get tested. No shame.
No shame. No shame. I'm Megan.
I'm Marcella.
And I'm Colin.
And thanks for joining us.
Thank you. Love you. Bye.
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 You will agree that the concepts will contribute to the rearing of a mature person.
An absence of
Oh, yeah, you don't have to be thinking about sex.